मैनेजमेंट की, management of ICP. So before starting of the management, we have some certain goals of the management. Goals of management. Now number one, first goal is we have to maintain ICP less than 20 millimeter of mercury. This is the first goal. Second is we have to maintain cerebral perfusion pressure or CPP more than 60 to 70 millimeter of mercury. Number third goal is we have to prevent secondary brain injury and the last goal is we have to optimize oxygenation, ventilation and hemodynamics. Now, after understanding the goals, now we have management is divided into supportive treatment and the specific treatment and advanced treatment. So we'll start with supportive treatment. Supportive treatment include number one, always follow ABC. Always. First we have to see the airway. We have to intubate the patient. If we have a low GCS, less than or equal to 8, or majorly it is on the clinical sense of the clinician. Second is we have to avoid hypoxia, as we have to keep our PaO2 level more than or equal to 100 millimeter of mercury. Number third, we have to maintain PCO2 less than or in between 35 to 40 millimeter of mercury, and also we have to maintain adequate MAP so that our cerebral perfusion pressure is maintained. Now, after that we have to, after this supportive treatment, another thing is positioning. It is always, whenever we encounter a patient of raised ICP or whenever we enter into the Neuro ICU, we have to make some positional changes. For such patients, position is head elevated, head up to 30 degree and neck in midline, and we have to avoid jugular compression, and tight cervical collar. रेज्ड आईसीपी का कोई भी पेशेंट फ्लैट नहीं बेड पे लेटना चाहिए, उसका हेड हमेशा एलिवेटेड होना चाहिए अप टू 30 डिग्री, नेक मिडलाइन में होनी चाहिए। अगर नेक मिडलाइन में नहीं होगी तो नेक जिस तरफ भी टिल्टेड होगी तो उस तरफ जगलर कंप्रेशन होने के चांसेस होंगे, और हमें अवॉइड करना है जगलर कंप्रेशन को। साथ में जो टाइट सर्वाइकल कॉलर इन केसेस ऑफ स्पाइन इंजरी या सर्वाइकल इंजरी में हमें टाइट सर्वाइकल कॉलर को भी ध्यान देना है। अनदर थिंग इन आईसीयू दैट दीज पेशेंट्स आर वेरी एजिटेटेड, ठीक है, तो सिडेशन और एनाल्जेसिया हमें इन दोनों का ध्यान रखना है, sedation and analgesia. So we have to avoid conditions like coughing, hypertension and agitation. And the agents for which for suppressing these conditions we use are fentanyl opioids, fentanyl. We can use benzodiazepine or short-acting benzodiazepine like midazolam, or in some centers propofol can also be used. Propofol. After this, there is very important thing that to be aid in the care of raised ICP patients is temperature control. Temperature control. If these patients have fever, then we have to treat the fever, because raised temperature can cause raised temperature can increase the cerebral metabolism rate of oxygen, and whenever there is increase in the cerebral cerebral metabolism rate of oxygen, there is also increase in the cerebral blood flow. Whenever there is increase in the cerebral blood flow, the ICP rises. So we have to treat the fever if the patient has fever. Another thing is we can also add anticonvulsants. Anticonvulsants we can use levetiracetam and phenytoin, which levetiracetam and phenytoin. So these were the supportive treatment for any patient with raised ICP. Now